An ECLO is an eye clinic liaison officer. The ECLOs sit in the ophthalmology clinics in the hospital. An ECLO provides support to patients from a practical and emotional perspective, and they do this as close to the point of diagnosis as possible. When a patient receives a diagnosis of an eye condition, this can be a very difficult time for somebody. It can have implications for the here and now and for the future. It's important that the patient doesn't feel alone. It's important that they know the ECLO is there to support them on this journey. The ECLO service takes referrals from the ophthalmology teams, other hospital support teams, from patients themselves and their families. Referrals can also come from community-based supports. The ECLO tries to see if the patient has a clear understanding of their eye condition. They do this by listening and asking the patient to reflect on the information given to the patient by the ophthalmologist on their eye condition. Sometimes the patient has incorrect information about their eye condition. We seek information from the ophthalmologist to clarify this to avoid confusion. The ECLO and the patient agree an action plan based on the needs of the patient that would involve referral into community supports. The ECLO refers patients onto community supports. These include Irish Guide Dogs for the Blind, NCBI, Child Vision, Fighting Blindness and Vision Sports Ireland. The ECLO may request an ophthalmic assessment report from the ophthalmologist. This form quantifies the patient's eye condition and the level their vision is currently at. This form may qualify the patient to apply for benefits and entitlements. The ECLO doesn't just work with the patient, they also work with the ophthalmology teams and other supporting hospital staff. They provide an insight into awareness and sighted guide training and an introduction to low vision aids. An ECLO meets patients from all different ages and stages on their eye journey. When a baby is diagnosed with an eye condition, it's the parents that we provide the emotional support to, provide practical support and signposting and community supports. Adults that we meet may be attending college. They might be having difficulty with accessing print information. They might be having difficulty with mobility and orientation. This is something we as ECLOs can refer them into the right supports.
It started in 2010, and at the time I was teaching sea kayaking professionally, so I was bringing people out on the water and so on. So I was up in Donegal and bringing somebody to a pre-dawn flight up in Carrickfinn Airport, and it was over very small roads, and I nearly went off a couple of times, and absolutely no drink involved. And so that was the first indication that my night vision was going. It was an hereditary condition which I got from my mother's side of the family called late onset retinal degeneration. So the first thing to go was the night vision, and then in 2013 we moved back home to Leitrim, and on the country rural roads I stopped night driving altogether then. Then in 2015 I found that I was getting trouble with daytime driving, and it was almost a little unexpected, because what was actually happening was that my central vision in both eyes was okay, and the outer peripheral vision was okay, but there was a ring around my central vision which wasn't. So all the colours merged together, but I essentially had a blind ring around my central vision. So I ended up, in 2015, I was scanning a lot when I was driving. And because I was doing that so much, I was still safe enough, but obviously knew that something was going badly wrong. Between then and 2020, that ring around the central vision started getting bigger, and in 2020 it closed in altogether in my right eye, and I could still see with my left down the middle, but the cone that I could see was getting smaller all the time. There were a lot of problems and a lot of adaptations that I had to make. For example, if I put something down, I couldn't find it. So that was a big change, and it was a big change for Sonia as well, because with things around the house, she couldn't just put something down and leave it there because it was just lost for me. That's quite hard to deal with, because even things like, how do you get toothpaste onto your brush and into your mouth without it going down your shirt or all over the bathroom or that sort of thing. It's quite difficult. So everything like that has to be, you have to find a new way of doing it, including pouring cups of tea, including moving around and walking and all that. That becomes very compromised. Another thing that I find difficult about the sight at the moment is that when I get up this morning, I know that that's the best my sight is ever going to be because it's deteriorating. So it becomes noticeable every month or so that something else has got worse. And that just takes a little bit of dealing with. But if you take it positively, it means that you appreciate what you've got. So earlier on this year was really quite difficult when I lost the last of the central vision. Then in August of 2021, I went to see David Keegan for the normal checkup that I get as part of the Target 5000. And he was very good and considerate and so on, and he sent me straight down the corridor to Elaine Crossan, who's the liaison officer. And I wasn't quite sure what to expect, but I got in, or we both went in to chat to Elaine, and it's really useful that both of us can do that because the whole issue of sight loss is a family issue. It's not just one person, unless they're living alone, of course, which is really difficult. She was great in that she was empathetic and listened to what my problems were and what my needs were, and that was great. And she really sorted two of the major problems that I had at the time. One was technical, in that I used to be quite a competent Word and Excel user, and I used them to quite a high level. So within a week, Elaine had me set up for a half-day's training with the NCBI technical person in Sligo. So he got me started on the JAWS screen reader on the laptop, and that was great. The second problem I had was, I suppose you could call it emotional. First of all, having no energy had been an awful drawback. But also, losing sight is a bit like having a death in a family, or if you lose a limb, it's the same mourning process, grieving process that goes on, and that takes a bit of time. And I wouldn't really have been a person to ask for counselling, and at that meeting Elaine asked me if I would like to try it, and I said yes. And again, within a week, there was a series of counselling sessions set up with Fighting Blindness, and that was really good timing because that got me kick-started. So I was having weekly sessions by phone with the counsellor in Fighting Blindness, and he was brilliant. So really, all that's happened thanks to that meeting with Elaine, and it gave me a massive amount of encouragement, and I'm now feeling much more self-confident and whole and useful. I feel like we're operating as a team again, like we used to work together when we were kayaking, and we worked well as a team, and I'm feeling that we're getting there again, and that's just fantastic.
I suppose, like Des has sort of touched on it, but I definitely feel it's a process that we've both had to go through. What affects one of us is obviously going to affect us both. And for me, I'm standing by watching Des deal with all these frustrations, and what can I do? All I can do is support him. I can't fix this. And that's been really difficult. That day going in to speak with Elaine, it was, I suddenly felt like we're getting support. Like that supports me, that supports him, and it kind of takes the weight off your shoulders, I think on that recent meeting with Dr. Keegan, when, he was sort of showed that he was shocked at the deterioration of Des' sight. And Des, as I said, he knew exactly how it was. I mean, he was living with it. But the timeliness of kind of having discussed that with Dr. Keegan and then immediately seeing Elaine and her sort of asking you how you were feeling, you know, it's kind of when you're in that situation, you realise, God, it's been tough. You know, it's really hard. So when she asked there and then, would you consider counselling? He said yes, and I was thinking, whoa, thank goodness, because I actually felt like it was the right thing for him. But you know, for me to say, will you go, is, yeah, it's just different. Do you know what I mean? So he said it, yes, and sorted.
We've only had an ECLO for the last 2 years, maybe, and it's the difference it's made to our service is huge. Before we had an ECLO, if, as the doctor, if I had to give some bad news, or maybe somebody was losing their sight, or they had a condition and we couldn't treat it, I could refer them to the NCBI or Child Vision or whichever service, but I couldn't directly make the link. And it's quite hard at that stage, at that very emotional stage, when you only hear half of what you're being told. The ball could drop there. The person mightn't hear what you were saying, and they have to make that link themselves. Now we have an iClinic liaison officer, an ECLO, and I can say to people, Hilary will call you in the next few days. And that's where that personal contact makes a huge difference. And we know that will actually happen. I explained to them what the ECLO's role is, and it's the way Hilary will pick the ball up, and that family she will talk to the person, the family, and she'll also know of other families in the same sort of situation, and she can link them up as well. But we're much closer. It's made a huge difference to our service. Our service is much better, more inclusive, and it's more personal. It's an awful blow to learn you've become visually impaired, but it's not the end of life. And our ECLO can help here. It's the personal contact that brings hope, brings continuity, partnership with the professionals, the researchers, the genetics, and the patient themselves.